Yet tonight, both sides negotiating, I'm told as of this afternoon, over the telephone, but just a few days left to try and get a conference committee approved before the session ends. A back and forth dialogue still underway, with thousands of working poor Mississippians still left wondering if they'll get help paying for health care. A milestone public hearing held Tuesday, not only because it was a conference committee on Medicaid expansion, but also because it was held in public.
The House offered a compromise position yesterday.
Representative Missy McGee is the Medicaid chairperson in the House, whose initial plan was to bring in some 200,000 working poor Mississippians under the state health care umbrella. She says the House is willing to lower the number of people who could be helped, but not walk away from millions of matching dollars from the feds.
If somebody is willing to give us 90 cents on every dollar, we felt like that was the best financial decision for the state of Mississippi, and it insures the most people.
It seems simple to me.
No Democrats on that conference committee, but Representative Robert Johnson says the state could make use of millions of more federal dollars that would benefit struggling state hospitals.
And so this whole idea that we don't want to expand Medicaid, we don't want any more Medicaid money, for people who work, when we're already taking $6 billion from the federal government, we can't take another billion?
The Senate Medicaid Chairman Kevin Blackwell seemed to be drawing a line in the sand that the Senate would not be willing to move far off of a plan that might cover just 40,000 people and require that they prove they work 30 hours a week.
I've been around this place long enough to know as long as you keep talking, something can get done.
Senator Bryce Wiggins is on that Senate conference committee who insists there is wiggle room, but not eagerness to move people who are currently paying for their own health care insurance.
Providers get paid more, there's better benefits for those who are covered. And so we don't want them coming off of that to go on to the Medicaid rolls.
And Governor Tate Reeves has not budged on his position that he is opposed to any form of Medicaid expansion. The Senate says it's very much aware that it has to pass a measure that would be able to override a veto should it come down to that. Just a few days left to get a conference committee report approved before the session sets to end at May 5th. This state's still one of just 10 in the country that has not expanded Medicaid. We're live tonight at the state capitol. Scott Simmons, 16 WAPT News.